And welcome back to American Agenda. I'm Heather Childers along with Bob Sellers. You know, we've been talking a lot about vaccines today, of course, with, Major League Baseball kicking off. We saw the full stands down there in Texas.
Right.
One of the things that they're talking about, which the governor of Texas stopped today, is the idea of vaccine passports.
Right, because there was talk that the federal government might require one, was going to produce one, and then I think Texas governor said, no, we're going to ban them here. And isn't Georgia considering the same?
I'm not sure they're considering it, but I do know that Florida also said no.
Florida.
Yeah, Florida
that's
said
right.
no, and now Texas said no.
Yeah.
Yeah.
So we wanted to talk to our panel about that. I've had mine. I have my card. But I got to tell you, Bob McEwen also joins us. And Bob, I'll start with you. Look, I don't mind taking my card in somewhere. If there's a restaurant owner or something that wants to make sure that I've had job, I'm fine with that. But I don't want the government with too much information. It already has enough, right?
Exactly. And the whole idea of my body, my choice, the idea that bureaucrats will decide what goes into my body, whether or not it meets their criteria. If not, they can make amendments, or else I would lose my freedom. The idea I couldn't go someplace or I couldn't fly. There's nothing is more tyrannical than that. This is just exponentially worse than anything we've ever seen in the world history, not just American history. So we need this discussion that because of a handful of folks that are a disease that does not rank in the numbers that we've seen. Those of us that grew up under polio, where my mother died and my brother died of polio, other people did. We've had pandemics before, but we never destroyed our nation or our freedom.
Yeah.
May I see your papers, right, Heather?
Yeah, I mean, Aaron, it would open the door, people were saying, in terms of these passports, these vaccine passports, it would open the door to a whole host of personal information being available to other people, and that was the primary concern.
Yeah, I disagree with Bob on this vehemently, because I think this is such a dangerous, slippery slope. In communist China, they have a digital footprint everywhere you go, and it starts right now here in America with potentially a COVID pass, but then it can switch on to something else. Also, we already know that these corporations are an arm of the Democrat Party. So just to say, oh, this corporation wants it, no big deal. I don't think anyone in America should be forced to get vaccinated. I truly don't, because we know that this disease has a 99.8 or 9% survival rate. Sometimes, and we don't know, by the way, I'm a lawyer and I went to law school, and I remember studying cases. I think the drug was called thalidomide. They thought it was safe for a very long time. Well, spoiler alert, it turns out that it wasn't. This drug has not been fully tested, and I don't think it's something that I want to put myself through. I already had COVID. I was asymptomatic. I recovered. This is not something that you should be forcing upon the American people. That is not what America is founded upon. It's absolutely wrong. It's absolutely terrifying. And this is not Nazi Germany. This is not communist China.
By the way, Aaron, let me make clear. What I'm saying is, I don't mind if I go to a local restaurant, and if the restaurant, just to put his mind at ease, I don't mind showing him my card. Look, I got these shots. I'm good. That's why we're. But I don't want the government producing a vaccine passport. I don't want that.
Before we continue talking about it, let's dip into the White House right now, where President Biden is actually talking about vaccines. Let's listen. I believe that we have that. I was just told we were going to go to that. There he is.
Will be eligible to be vaccinated. No more confusing rules. No more confusing restrictions. My message today is a simple one. Many states have already opened up to all adults. But beginning April 19th, every adult in every state, every adult in this country is eligible to get in line to get a COVID vaccination. And today, in advance of that new national full eligibility date, I want to make a direct appeal to our seniors and everyone who cares about them. While we have made incredible progress vaccinating 3/4 of our seniors and putting vaccination sites within 5 miles of 90% of the public, it still isn't enough. It's simple. Seniors, it's time for you to get vaccinated now. Get vaccinated now. To make it easier, my administration is sending aid to community groups to drive seniors to vaccination sites. We're incredibly grateful to all the volunteers, houses of worship, and civic groups that are helping us in this effort. This is America. We take care of one another. We have to keep it up. As I ask seniors to sign up for their shots now, I also have a message for people under 65. If you know someone over 65 who's not gotten this life-saving vaccine, call them now. Work with them to get their shots this week or next. Pick them up, drive them. It can be your parents, your grandparents, your aunt, uncle, your neighbors. And finally, even after we open up vaccinations to all adults and put a site within 5 miles of 90% of the public, we know there are many people who still struggle to get access to a shot. We know that there are a number of seniors and people with disabilities and people in many communities of color who may be isolated and lack access to transportation. That's why we're ramping up transportation to vaccination centers and deploying more mobile units and pop-up clinics in the places close to where people live. That's why we're working with faith-based organizations and other community groups.
President Biden had visited a COVID vaccine location in Alexandria, Virginia, now speaking about moving up the date for full accessibility to get in line to April 18th versus May 1st. Didn't know, Aaron, if you had finished your thought. You don't want to show it to the local restaurant owner either, right?
No.
Okay.
I mean, I think it's just, I'm not chastising you. I understand what you're saying, of course.
Oh, I've been chastised before, so no problem.
Well, I'm not going to stand in that line to do it. All I was simply saying that the lawyer in me thinks that this is a slippery slope.
Yes,
If
I
corporations
agree.
start requiring this, if businesses that are, local start requiring this, there are HIPAA concerns. And by the way, as our great president just indicated, that in some underserved communities, how are you going to get the vaccine? So this could be seen as elitist, classist, and even racist.
Yeah. Go ahead, Derrick.
You see, I was a little excited about Aaron's point. And to Aaron's point, a lot of folks, all right, they still don't have access. I was fortunate enough. I've had both my vaccines. Had the Pfizer. Finished the second dose on March the 9th. But there are still a lot of folks who don't have access. But in addition to those folks who don't have access, I was out cycling and I left my water bottles. This was Sunday. So I had to stop and get some Gatorade. And I walked into the store. I had to put my bandana around my mouth, with the mask on.
Right.
And I went in and I said, no worries, guys. I've had my vaccine. And the people behind the counter was like, why did you do that? And he couldn't believe that me, as an African-American man, had already gotten my vaccine.
Yeah.
So in addition to that, it's people not having access to it, there still needs to be a huge education outreach campaign.
Well, Aaron's quite educated. It just sounds like she doesn't want it.
No, a lot of people still in these communities are still uneducated. There's still a lot of myths associated with this vaccine. I mean, I got the same individual said, well, how do I know that they're going to give me the same vaccine that they give to the white person?
Yeah. Well, I got to tell you, I've probably eaten at more restaurants than anybody over the past year, and nobody's ever asked to prove anything. So I'm just trying to make others feel at ease. It's interesting. We kind of threw this topic at you unannounced, and it obviously is something a lot of people have emotional feelings about. Yeah. So there's going to be a lot of talk.
Yeah, I did want to say at least a little something about it, and we were discussing off camera that I've not been able to get a vaccine yet. I was able to finally get an appointment, and one of the issues I believe has been a lack of available doses. So you can have additional sites and you can have transportation to these sites, but if you don't have enough doses to go around, and I think that's still a problem, then you have a problem.
That's because you're in New York.
Yeah.
And many states still don't have enough doses. And I know firsthand some individuals who left Virginia, used someone's address in Maryland, and came over and got their vaccines.
I got mine in Virginia, though, Derrick. But it was Fairfax County.
Shady stuff still happening.
Okay. All right. Interesting conversation. All right. Panel, we have more after this.